For 14 days in Vietnam, a group of volunteers travelled to rural areas and performed thousands of medical and dental procedures to help the poor. Cataracts are one of the major causes of blindness in Vietnam. Cataracts are preventable and treatable in Australia and in many countries around the world. If an individual can get regular eye checkups, cataracts can be detected early and treated to avoid blindness. However, many Vietnamese people in rural areas are not fortunate enough to access that service and become blind. In Vietnam, people living in the rural areas are usually unable to afford medical and dental services. Those services are very limited to major cities and large provinces. The majority of rural villages are poor and live further away from hospitals.
Vietnam Vision Project has provided thousands of cataract surgeries for the last 10 years. Every year, the group organizes a 14-day trip to rural Vietnam, caring and providing surgeries on cataract.
The organisation receives some donations from the public through fundraising events in Sydney and Melbourne. The organisation uses the collected funds and donations to purchase medical equipment and medicines to care for those people.
Eye doctors, nurses, optometrists, and lots of volunteers. They pay for their own travel expenses when they volunteer on these 14-day trips to Vietnam.
Besides adults, many children born with some forms of defective eyesight desperately require some surgery to correct their vision. Unfortunately, many have suffered all their lives since they cannot afford the surgery, and the medical experts are not available in these rural areas. In Vietnam, public hospitals in the rural areas do not have eye doctors to treat these cases. Many people urgently require this type of surgery and usually become blind at the end unless treated.
In 2011, a dental team joined the Vietnam Vision Project and treated over 800 patients in rural villages where the dental service did not exist. Many children in rural Vietnam are from very poor backgrounds. They are not able to access any dental service at all, and most of them just suffer from severe dental pain throughout the year. Dental decay can cause pain, headaches, oral infections, stomach problems, and heart disease.
These dental volunteers provide basic dental care to these kids. They help to get those children out of pain and educate them about dental care and how to look after their teeth.
These volunteers work very hard under extremely difficult conditions. They aim to treat as many children or adults as possible because every single person requires some dental treatment, from minor to major procedures.
When you look into their eyes, you can see that they really appreciate all the good work the volunteers provide to their families.
There are lots of things that we as a community can participate in to help those poor Vietnamese villages.
Vietnam is a very beautiful place, but its people are still suffering from hardship and poverty, especially in rural areas.
We can help those unfortunate people in Vietnam, especially in the rural areas, by volunteering to provide dental and medical care, or to run the administrative office, or to raise funds, or just to donate to a good cause.